So today in this video, I will be demonstrating how to take a patient's blood pressure, but in substitution of a patient's arm, I will be using my Nalgene water bottle. Oops. So, first things first, what I would do if this was a patient's arm, I would palpate to find the brachial pulse in the elbow, and I would use that when applying pressure to the cuff through the pump here, and I would feel when I can no longer feel the pulse, and corresponding with that number, I would then add 30 and then use that number when I'm actually trying to find the systolic and diastolic sounds. So what I'm going to do is I'm going to apply the cuff here. When applying the cuff on an actual patient, it's important to make sure that you align the artery with one of these arrows, depending on which arm you are applying the blood pressure cuff to. And the blood pressure cuff should be located about an inch above the crease of the elbow and should be too tight. If it doesn't fit properly, you're going to get inaccurate pulse readings, pressure readings. So, keep sliding on me. There we go. All right. So, what I'm going to do now is I'm going to inflate it until I can, in theory, no longer feel the pulse. The number value that I'm going to assign to that is 170 millimeters mercury. So, I'm going to make sure that my pump is closed, and I'm going to start inflating it. So, 1. Okay, so now it's at 170. And I'm going to slowly let it out, making sure that I'm not getting any sudden droppings, because this can cause me to possibly lose the sound. But that's more important for the second step. I'm going to let it drop slowly to 60 millimeters mercury. And there we go. All right, and then I can release the valve. Okay, this would be the value, like the number when I can no longer feel the pulse. Like I said, I would add 30 to that, and that will be the number that I pump to when I'm finding the systolic pulse. So I'm going to close the valve again. This time I will be inflating to 150 millimeters mercury, as dictated by my teacher. So, and then I'm going to use the pump again to slowly let out. This is when I would have my stethoscope placed under the blood pressure cuff and hearing for sounds. When I hear the first sound, that is the systolic sound 1. That's systolic. This is when I have to make sure not to have any big sudden drops, dropping 2 to 3 millimeters per second. And I would keep listening until I can no longer hear a sound. This time I'm going to be dropping until 50 millimeters mercury. And I did have a bit of a sudden drop there, but all right. And that is how you take a blood pressure. The values that I get for the first sound and the last sound that I hear correspond to the systolic and diastolic of the average blood pressure being 120/80.